Well, welcome everyone. Our speaker today is Dr. Anjali Satoskar.
Thanks, Vanderlene. Thanks, Nico. And thanks to GlomCon for this invitation. It's a distinct honor to speak on this platform, which has truly become international. So on that note, I will begin since it's a little bit of a long lecture. The first question is why choose this topic? Why talk about Bartonella specifically? Because after all, it is just one of the pathogens causing IRGNs among so many. So the few reasons that I found were one is this is a very uncommon cause of endocarditis. It's a rare. Overall, this disease entity is rare as compared to staph-associated GN and even post-streptococcal GN, which has been extensively written about in the last several decades. So the number of Bartonella endocarditis-associated GN cases in any single institution is very small. I was able to find only 4 cases. We've been practicing for the past 15 years. Another published case series from a single center is by Boyles et al. From Arcana. They also found 4 cases of Bartonella out of their 40 or 48, I think, patients of endocarditis, which they published. There is one center in France, though. It's I may not pronounce it correctly, but Au Marcial Hospital in France, which is a referral center or a reference lab for testing blood culture negative endocarditis cases. They get cases from all over the world. So they probably have a lot of cases, which they have published over 100 cases of Bartonella endocarditis over a period of 9 years, both retrospective and prospective cases. But even their study focused mainly on the endocarditis part. GN was not studied. So there are case reports, there are some cases presented at the ASN, but overall it just, we see it now and then. So I thought this was a good topic to study and to talk on. The other reason, even though we say it is rare, the epidemiology seems to be changing. And maybe because of better diagnostics, we are catching more cases to the extent that the latest Duke criteria, which the clinicians use for the diagnosis of endocarditis, much like our BAMF criteria, which undergo a lot of iterations and improvements, the latest updates have actually included Bartonella diagnosis as one of the major criteria for diagnosis of endocarditis. Previously, a lot of emphasis on these microbiologic major criteria were on cultures for both typical and atypical bacteria. But a lot of these bacteria are difficult to culture. So other lab tests are required. The previous version of Duke criteria did include Coxiella, serology positive. But this latest update has now included Bartonella along with Coxiella and Trophirima vipelli, either PCR testing on the blood or serology using indirect immunofluorescence assays. If you have positive serology for Bartonella, it is considered, or it constitutes as one major criteria for the diagnosis, for a definitive diagnosis of endocarditis. You need just 2 major criteria for diagnosis. So this is just to highlight more and more detection of Bartonella in the community. I don't want to talk about the Duke criteria. It would be a lecture by itself. But a lot of things have been now incorporated because of the large number of intracardiac implantable devices that are put inside the heart for various diseases, including transcatheter implanted valves. All these are equally at risk for infection, just like surgically implanted valves. So there are some bacteria which are typical or specific for prosthetic valves rather than native heart valves. So putting all this information together, the updates to the Duke criteria were made. Although the general structure was not changed, they have now incorporated a lot of nucleic acid-based testing and amplicon testing, metagenomics for identification of the underlying pathogen. But I wanted to highlight that Bartonella has now been included as a major criteria. Another important little study that I found related to Bartonella. It comes from the Cleveland Clinic. Our colleague Liel Hurlitz is a co-author on that. What they studied was association between causative pathogen in endocarditis and the occurrence of infection-related glomerulonephritis. Basically, what they're looking for is if you develop endocarditis because of a certain pathogen, what is your likelihood that you will, or it will be followed by the development of a GN, IRGN. And that's important because I have been studying staph-related GN for quite a few years now. There are so many patients of staph infection, but the fraction of cases that go on to develop IRGN, or related glomerulonephritis, is minuscule. But in contrast to that, Bartonella has a very